So now we're all waiting to hear what the main recommendations are of the report. And with further ado, I'll pass it to my colleague, Ana Moreno, who has been the main author of the report. Ana, the floor is yours.
Thank you, Enrique. Good afternoon. Good morning, everyone. I would like to start by thanking the contributors to the report, some of whom joined us today in the room. In this presentation, I will provide you with an overview of the assessment and recommendations of the report on four main areas: education, healthcare, digitalization, and governance. Next, please. Next. So with respect to education, the report identifies a series of challenges and opportunities that relate to the impact of megatrends in rural areas, which include aging and population decline. Among these, we identified that an important challenge is the low scale of provision of rural schools, like was mentioned before, especially in communities where student numbers are declining. While this low scale brings benefits such as closer contacts with teachers, it also affects the financial viability of schools, and more importantly, it may also affect the quality of education, for instance, through a less diversified educational offer that then has consequences on the prospects for rural students. Here in the recommendations, we suggest that policies can be made more flexible to help increase class sizes and diversity, for instance, by allowing multi-grade classrooms like in Italy. Governments can also support the creation of informal networks, and we'll hear about this in the panel, of rural schools, or even more formal structures like in Portugal of school clusters where schools cooperate under a single leadership. Policies can also draw from innovative approaches, such as integrating and co-locating education with other public services, including kindergartens and daycare centers. And of course, policies can also utilize the huge potential of digital education to increase the diversity of curricula by tailoring these tools to the reality of rural areas. Above all, however, we find that policies need to place the attraction, retention, and empowerment of teachers at the heart of rural service reform, because in the end, the quality of education depends on the quality of teaching. Next, please. Regarding healthcare, our report stresses that density and distance actually mediate this trade-off that you see between cost, quality, and access. For instance, when higher efficiency and quality are achieved by concentrating specialized medical services in cities at the expense of longer travel times for people outside cities. This means that place-based policies actually have an important role to play here, especially because of existing long-standing gaps that you see illustrated there in all the three dimensions when you compare rural versus urban areas. Here, in fact, people-centered strategies can work to address these territorial disparities, for instance, by maximizing the potential of locally provided primary healthcare, also integrated healthcare, because this lowered the incidence of chronic diseases, lowered unnecessary hospital admissions, for instance, by implementing innovative approaches such as mobile clinics and testing facilities in rural areas. In the report, we also find from evidence from France that multidisciplinary centers that bring together medical professionals such as doctors, nurses, nutritionists, and psychologists can work very well in rural communities. And this can be complemented by emerging forms of telemedicine, such as real-time monitoring of patients that offer a great opportunity to complement the still needed physical provision in rural residents, especially for the older ones and those that live in remote areas. Moreover, innovations in the management and organization of rural hospitals can help with their financial viabilities through the implementation of new models such as hub and spoke, like in the case of Italy. As in the case of education, however, governments need to address and anticipate medical workforce gaps, for instance, by expanding the roles of nurses and pharmacists, and help decide attractive relocation packages that go beyond financial incentives and focus on career progression for service professionals. Next, please. Now, regarding digitalization, our report notes that moving towards digital provision requires first to solve the issue of rural-urban connectivity gaps. The solution is not straightforward because previous generation slower technologies are still dominant in rural areas, while new technologies such as 5G are deployed first in cities where markets are large and dense and costs can be more easily recouped. Here, our report pledges that policies can support the efforts of local governments and also local actors such as non-profit cooperatives, not only by adapting their regulatory instruments to their needs, but also by reducing barriers towards small-scale market entry and by encouraging local control through funding instruments. Policymakers also here need to take a careful approach to subsidies for connectivity in order to ensure that they align with long-term solutions for rural areas. Here, for instance, broadband voucher schemes that are made accessible to community-led efforts can stimulate competition through the entry of new players in the market. Also, public-private partnerships can steer changes in the marketplace while balancing the risk borne by taxpayers. Efforts, however, cannot be limited only to improving physical connectivity, and government really need to invest in improving the digital skills of rural dwellers of all ages, and this includes teachers, students, doctors, and nurses, so they can make the best of these new tools and this improved connectivity. Next, please. So now for our final part on governance, the report starts by noting that the responsibility of subnational governments in the provision of services has increased in the last decades because decentralization has increased. Often, however, there is a misalignment between the responsibilities of subnational governments and the resources that are made available to them. Here, better governance can be achieved by making finances consistent with the actual cost of delivering services, by also identifying and addressing overlapping responsibilities, and by strengthening local governments through capacity building. Moreover, because the scale of provision may be too low or too high compared to administrative levels, government solutions should also address issues that relate to spatial spillovers or large-scale economies by promoting interjurisdictional cooperation and municipal mergers when capacity and population are low. And also, I look forward to a discussion on this in the panel next. And finally, although the responsibility is devolved to municipalities of regions, the scale of provision does not necessarily need to coincide with administrative borders. And here we pledge that governments can promote the use of functional service areas and also promote cooperation across borders to make sure that services are provided at the right scale in an efficient manner. And with this, I finalize the overview of the main takeaways of the report. I welcome you all to consult the report, to give us your feedback, and I really look forward to a fruitful discussion in the panel and to your questions. Thank you very much.